Good morning, my name is Scarlett from CSU Bathurst. Today I will be helping you to better understand a condition called dysmetria. Dysmetria, a Greek term meaning wrong length, can be characterized by the inability to perform voluntary or goal-directed movements with accuracy and control. For example, here we have a person performing the finger-to-nose test. This test is used to assess the rate and smoothness of movement of the upper extremities. The task requires a person to reach out and touch the end point of a pen with their index finger and then alternatively touch their nose. A person showing signs of dysmetria will not be able to perform this task in one smooth movement. Instead, they will make several corrective movements as a result of either overestimating or underestimating the time and force required to reach the target. This occurs because there is an imbalance between the range, rate, and force of movement. Primarily, this is a sign of cerebellar dysfunction, however can also be associated with lesions to the brainstem, thalamus and subcortical white matter along afferent and efferent pathways. There are many causes for cerebellar lesions and they can be a result of alcohol and drug abuse, vitamin deficiency or caused by neurological disorders such as multiple sclerosis, motor neuron disease and stroke. Specifically, lesions to the dentate nucleus, interspostis nucleus, and lateral cerebellar cortex result in limb dysmetria, whereas saccadic dysmetria is associated with lesions to the dorsal oculomotor vermis and fastigial oculomotor vermis. There are two classic motor signs of dysmetria, hypermetria and hypometria. Both are evident in limb and saccadic dysmetria, however hypometria is more common and is sensitive to speed and inertia which can exacerbate the condition. Hypometria can be categorized as the overshooting or overstepping the target as a result of the prolonged burst of the agonist muscle and subsequent delay in the onset of the antagonist muscle. In contrast, hypometria is associated with undershooting or understepping the target caused by the prolonged latency of the antagonist and reduced intensity of the agonist muscle. Overall, people with dysmetria show errors in trajectory. This is marked by an impaired initiation and increased variability of movement, particularly with fast single joint movements. This can be seen in Figure 1. B represents the cerebellar patient. As you can see, the dotted line is the target and the top of the graph is the starting point. You can see there is an increase in movement trajectory followed by the overshooting of the target, whereas there's one smooth movement in the control subjects. Further, Figure 2 represents a change in the trajectory as velocity or speed increases. The cerebellum plays a pivotal role in error-based motor learning and is essential for the fine-tuning and execution of precise movements, along with predictive control of movement. To carry out these precise movements, the cerebellum relies heavily on information received from proprioceptive, vestibular, and visual systems for sensory motor integration. This is essential to control the rate and smoothness of movement. Dysmetria is a manifestation of abnormal cerebellar function, hence the disturbances in balance, coordination, and ocular motor control. The net result is impaired sensory motor integration, which affects the ability of the muscles and joints to respond and adapt to the many interactions between the body and the environment. Ultimately, this affects the ability of the person to execute goal-directed movements with control and accuracy. There is currently no known cure for dysmetria as it's mostly a symptom of cerebellar dysfunction. Therefore, the effectiveness of treatments will depend on the cause and extent of brain lesions and whether the condition causing dysmetria is degenerative or not. Furthermore, it can be challenging to prescribe exercises given the highly complex role the cerebellum plays in error-based motor learning and predictive control of movement. Accordingly, exercise programs should progress from simple to complex to compensate for these underlying deficits and disease progression. To achieve this, the encouragement of breaking down of movements into single joint movements is recommended as it helps facilitate sensory motor integration by increasing proprioceptive feedback, thereby improving fine-tuning and execution of movement. Another approach to alleviate symptoms of dysmetria and enhance quality of movement is by increasing the inertia of limbs. This can help improve tracking patterns and decrease high velocity peaks through regulating agonist and antagonist activity, helping to restore normal damping in the muscles. Lastly, physical therapy and technological aids that optimize the integration of proprioceptive, vestibular, and visual system are integral to improving neuromuscular coordination, thereby enhancing the functional ability of movement and quality of life for people suffering from dysmetria.